Statistics Canada, nearly 60% of internationally educated healthcare professionals employed in their field of study in Canada. A recent report by Statistics Canada reveals that 58% of internationally educated healthcare professionals, IEHPs, in Canada are working in their field of study. This includes nurses, physicians, pharmacists, and dentists. Among the 259,694 IEHPs in Canada, 76% are employed. It's important to note that this data includes IEHPs who are not working in a healthcare occupation. According to data from Immigration, Refugees and Citizenship Canada, IRCC, immigrants make up a quarter of healthcare sector workers in Canada. With 500,000 healthcare workers over the age of 55 expected to retire in the next decade. Half of IEHPs in Canada immigrated during their core working years. Between the ages of nearly one-third of all IEHPs arrived in Canada between 2016 and 2021. Two-thirds of IEHPs are younger than 50 years old. The highest number of IEHPs are living in Ontario, followed by British Columbia and Alberta. The lowest numbers are found in Canada's Northern Territories and the Atlantic provinces. Prince Edward Island has the fewest IEHPs, 3 Nova Scotia has. Asian educated IEHPs account for 75% of IEHPs in Manitoba. One-third of IEHPs in Canada studied nursing. The top 5 occupations among them are registered nurses and registered psychiatric nurses, nurse aides, orderlies, and patient service associates, licensed practical nurses, light-duty cleaners, and social and community service workers. The latest job vacancy data shows 147,100 job vacancies in the healthcare sector in June this year. The report suggests that there are many IEHPs already in Canada who could contribute to addressing these labor shortages. The main challenge for IEHPs is getting licensed in a regulated profession in Canada. Provinces like Nova Scotia and Ontario are taking steps to remove obstacles for IEHPs. Nova Scotia offers an expedited pathway for international nurses, while Ontario has introduced legislation to streamline registration decisions and remove the requirement for Canadian work experience in some cases. IRCC has created 6 new express entry categories that prioritize healthcare professions. In 2023, there were 2,000 invitations to apply have been issued to healthcare professionals. Additionally, physicians already practicing in Canada as temporary residents can now become eligible to apply for express entry. With nearly 60% of IEHPs employed in their field of study, efforts are being made to address labor shortages and remove obstacles for IEHPs, ensuring that their skills and expertise are utilized to the fullest.